The goal of the anger management is to reduce the emotions that are associated with the anger, the emotional feelings associated with the anger, and also to control the physiological effects, the physiological arousal that happen in the body due to the anger event. Hello, I'm Dr. Carlo Demarco, consultant psychologist at My Minder Psychology Center. This is another edition to our series of the anger management therapy program. Well, the goal of the anger management therapy is not to suppress the emotions associated with anger. Again, it's also not about getting rid of the anger itself or getting rid of the people that cause anger, because we will never be able to do that. We still will have to deal with the same people, deal with the same situations and events. The goal of the anger management is to reduce the emotions that are associated with the anger, the emotional feelings associated with the anger, and also to control the physiological effects, the physiological arousal that happen in the body due to the anger event that caused the anger in the first place. The first step is identifying the problem. Second step, identifying the feelings associated with that problem and the feelings of hurt, frustration, annoyance maybe. The third step would be to identify the specific impacts of this issue on you and on the people around you, and perhaps on the other person, if this kind of behavior is caused by another person. The fourth step would be to decide whether to resolve this conflict or not. And this is a very important step, because in some cases you find that the conflict is not worth addressing. It's just something very trivial that life can go on without, instead of like raising a conflict with every situation in life. And then once you decide that this conflict is worth raising and it needs to be discussed, then the fifth step comes in, which is addressing and resolving the conflict. And that step will involve setting up time with the person concerned to talk about the conflict in a calm manner, with setting up certain rules about talking about the conflict and how to resolve it. In some schools of therapy, they would adapt the attitude of suppressing the anger and maybe channeling it or directing it into a positive emotion, another positive emotion, converting it to perhaps something more useful. But the risk of doing so is, if you don't provide the outlet for this anger to come out as a positive emotion or as a constructive behavior, the danger is that this type of response will be locked in, and then it will turn into what we mentioned before, to an unexpressed anger that will create the same problems we mentioned earlier of being expressed in criticizing behavior, sarcasm, and degrading of the other person or the events around you. Also, some people will say that it's better to let it all hang out or let it rip, where you let all your anger out and just offload all your anger at the event or the people that you're dealing with. And it goes without saying that this actually will escalate the problem and it will create more anger. And people who do so, they will find themselves getting angry all the time and allowing themselves to hurt other people without any control of their behavior. And perhaps after a while also, like, one of the feelings associated after an explosion of anger is regret and feelings of guilt. But when this becomes a habit, the person will get rid of the feelings of guilt or regret, and then they will be just an angry person that people will fear dealing with or being around. Anger management will control anger by understanding the reasons why you get angry in the first place and understanding the emotions associated with this anger. Also, it will help by knowing that anger is a normal feeling that we all have. It's a normal emotion that we all have due to certain times, events, or people. What we will benefit from anger management therapy is, through the emotional understanding, we will gain more emotional control over our feelings without having to suppress these emotions. Because some people who say that they don't get angry, for example, they suppress their emotions, and this suppression of emotions will result in these emotions coming out in one way or another. And sometimes it comes out in what's called passive anger, where the person would express their anger in sarcasm or in silent treatment or in stonewalling or perhaps in being sarcastic about the event or the people that he's angry or she is angry. What you can do when you are in an anger management therapy session, Well, if there is good therapeutic rapport between you and your therapist, or what I call a therapeutic relationship with your therapist, you should be able to talk and do anything during sessions, of course, within the normal boundaries of behavior. You should be able to speak to your therapist about the reasons of your anger, about anything, about any hidden emotions that you have, without shame, guilt, or regret, in full confidence, understanding that whatever you are saying, it is fully confidential and it's between you and the therapist who's treating you. The number of sessions required, or how long it will take for anger management to work for an individual, normally it takes 4 to 8 weeks, with 4 being the minimum required for anger management to work. We prefer to say 6 to 8 weeks, but it can be condensed to 4 weeks. But normally it takes 6 to 8 weeks for anger management to work. And in that time, you should feel an improve in the behavior, in the way you feel about anger, and people around you will feel also the changes within you and the way you handle things, the way you see things after every session. So it's 6 to 8 weeks for anger management sessions to conclude.